Myself Vignesh Vimal, and I am going to present a presentation on childhood apraxia of speech. So before going on my topic, I would like to draw your serious concern about various symptoms of COVID-19. COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. Most common symptoms: fever, dry cough, tiredness. Less common symptoms: ache and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on skin or discoloration of fingers or toes. Serious symptoms: difficulty breathing or shortness of breath, chest pain or pressure, loss of speech or movement. Seek immediate medical attention if you have serious symptoms. Always call before visiting your doctor or health facility. People with mild symptoms who are otherwise healthy should manage their symptoms at home. On average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it can take up to 14 days. Now coming to our topic, that is childhood apraxia of speech. So, apraxia is a motor speech disorder that makes it hard to speak. It can take a lot of work to learn to say sounds and words better. About childhood apraxia of speech. In order for speech to occur, messages need to go from your brain to your mouth. These messages tells the muscles how and when to move to make sounds. When a child has apraxia of speech, the messages do not get through correctly. The child might not be able to move their lips or tongue in the right ways, even though their muscles are not weak. Sometimes the child might not be able to say much at all. A child with CAS knows what they want to say. The problem is not how the child thinks, but how the brain tells the mouth muscles to move. CAS is sometimes called verbal dyspraxia or developmental apraxia. Even though the word developmental is used, CAS is not a problem the child outgrow. A child with CAS will not learn speech sounds in typical order and will not make progress without treatment. It can take a lot of work, but the child's speech can improve. Signs and symptoms. Not all children with CAS are the same. The child may show some or all of the signs below. Parents should talk to their doctors or see an SLP if the child is older than 3 years and does not always say words the same way every time, tends to put the stress on the wrong syllable or word, distorts or change sounds, or can say shorter words more clearly than longer words. Children with CAS may have other problems, including difficulty with fine motor skills, delayed language, or problem with reading, spelling, and writing. Causes. Most of the time, the causes of CAS is unknown. In some cases, damage to the brain causes CAS. Damage may be caused by genetic disorder or syndrome, or by a stroke or traumatic brain injury. Testing for childhood apraxia of speech. To test for CAS, the SLP will look at the child's oral motor skill, speech melody, that is intonation, and how they say different sounds. To test how the child says sound, the SLP will check how well the child says speech sounds alone and combined in syllable or words, and check how well others can understand what the child says. Parents should also talk to the doctors who can check for any medical problems. It is important to have the child's hearing checked by an audiologist. A child with a hearing loss may have more trouble learning to talk. Treatment for childhood apraxia of speech. A child with CAS should work with SLP. The child may begin the therapy 3 to 5 times per week. As speech improves, treatment may be less often. Individual or group therapy may be appropriate at different stages of treatment. So, what are the treatment goals? The goal of treatment is to help the child say sounds, words, and sentences more clearly. The child will learn how to plan the movements needed to say sounds and make those movements the right way at the right time. Doing exercises to make the mouth muscles stronger will not help. Mouth muscles are not weak in children with childhood apraxia of speech. Working on how to move those muscles to say sounds will help. The child must practice speaking to get better at it. It helps to use all the senses when learning how to say sounds. The child may use touch cues like putting their finger on their lips when saying the p sound as a reminder to close the lips. Visual cues like looking into a mirror when making sounds, or listening cues like practicing sounds with a recorder and then listening to hear if the sounds were made correctly. Other ways to communicate. In order to communicate, the child may learn sign language or may learn to use picture boards or computers that talk. This is called augmentative and alternative communication, AAC. Some parents are afraid that their child will only want to use AAC system and not try to talk. There is no evidence to support this idea. AAC systems support communication and help the child as they work on their speech with the SLP. Why family support is must needed. Childhood apraxia of speech treatment takes time and the child will need family support. Parents must practice what the child learns with the SLP to help them make progress.
Say hi. So Tyrion has something called childhood apraxia of speech, and he came to me when he was 3.5.
He kept on trying to get him to talk, didn't know what to do, and he would stay sheltered and be frustrated. He'd cry at night.
Put your tongue on your mouth. L. Yay!
I kept on thinking, well, he'll just grow out of it.
Can you tell me yes?
I set up the appointment with Children's and I came here, and then I said, well, I'm going to do it a couple times, and then after those couple times I seen what apraxia was, and I thought, oh my gosh, you know, we need help, it's serious.
When he first came, I was really concerned because literally he had nothing. Here you go. Excellent, Tyrion. Now he is able to produce sounds, both vowels, consonants, and different motor patterns.
She gets him to say stuff that I could never do.
Kids with childhood apraxia of speech really need to focus on the face, focus on the muscles of the face. The more gestures that we can use to help them, the more successful they are. Wing. Doesn't have, you know, conversational speech yet, but you can get a lot of what he says, I would say about half the time. I am really hopeful that he'll be a complete verbal speaker. I think, I have no doubts that he will.
He is sleeping.
He is sleeping.
I'm proud, and I feel like I want to say it for him, you know, but he's getting it out on his own now.
Little Locket.
Just
makes me feel hopeful for other families when they come in and their child's sound system is so disordered, that I can offer them hope and I can say, look, here's a child who started out at this level and look where he is now.
Puppies take bubble bath.
Puppies take bubble bath. It makes me feel like I'm really doing a good job, I guess. Try it all together.
I see potato.
Nice work. Good job.
Thank you.